Hello, welcome, and thanks for joining us to help choose home when care is needed, a podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and Core Cubed. Today's episode is number 7 of Season 3. Our guest today is Jan Jones. She is an RN and a BSN and is Chief Executive Officer of the Elizabeth Hospice, which is in San Diego County and Southwest Riverside County in California. Jan has been a hospice professional for over 3 decades and brings a wealth of information to consumers on what is hospice and how does one use it and how does one find out more information about it. So please help me, won't you, and welcome Jan Jones to Help Choose Home. Well, I just thank you so much for joining us today, and I would love for you to start this podcast by talking to me about the Elizabeth Hospice and what model of care your agency provides.
Thank you for asking. It's a pleasure to talk about the Elizabeth Hospice. We're an organization located in San Diego, California, and we've been providing hospice care to people for 41 years. And the model of care looks like this. We have on our team, working closely together in an interdisciplinary fashion, doctors, nurses, social workers, home health aides who provide personal care as in bathing and helping with food preparation. We have volunteers who go out and provide friendly visitation to people who are on our care. We work with individuals who are experiencing serious illness and their families. We work with their families as well and helping them to adjust to the serious illness. We, in the interdisciplinary team, not only are the members of the team there to collaborate and provide all support, I failed to mention our spiritual counselors as well, who are a very definite part of our teams. And in addition to the fabulous support from the team of people, additionally, in the hospice Medicare benefit, all of the medications and supplies as they relate to the terminal prognosis are provided by the hospice. So there's a financial support in that way. There's no payment on behalf of the person experiencing the care. So it can be a very helpful piece of adding to the care that a person gets when they are seriously ill.
There is confusion with people about hospice, and I know it's not a place you go to die. It's really a place you go, or a service to help you live.
Exactly.
Your hospice, though, I was excited to read, and you have all those wonderful supportive services, but you also have some unique services.
We do indeed, and those encompass our grief support services that are available to the community at large, and we focus specifically on children's grief. Not that we don't also do an excellent job of working with adults who are grieving, but we have programs where we go out into all of the school systems in our service area. We work with school counselors, we work with the children. Obviously in COVID, most of that work has been being done virtually with Zoom or other applications, but we really have a very strong, solid grief support program for adults and children specifically. Often the children are left behind in that whole process. So when there's a loss in a family, everybody is grieving, but they grieve in different ways. And so having the support that we provide, which is supported by community donations, is so helpful.
In these times where...
Absolutely, especially in these times, because people are losing their loved ones. If they're in the hospital, they aren't able to visit. If they're in a nursing home, they're not able to visit. That's a very difficult situation for families to be in. We've had situations where we've been able to bring a person home in order to care for them in their final months because the family wanted them at home instead of in a facility so they could be with them. And that has been really helpful for us to be able to do that. And the family members are very, very appreciative.
Well, and let's talk about safety, because you're bringing someone home from an institutional setting into a private setting. What types of personal protective equipment or protocols have you put in place in addition to what was done prior to COVID-19?
Right. We follow all of the CDC guidelines. We have, in the very beginning of COVID, we, like everybody else, were struggling for enough personal protective equipment, but that has eased off and we are well supplied with our personal protective equipment. We wear the personal protective equipment at the point where the CDC guides us to. So we are very safely providing. We have had none of our staff come down with COVID-19. We have cared for a few, very small number of people who had COVID-19, but none of our staff have been actually experienced COVID. So, and we work with families and help teach them how to protect themselves, both if they are going to the grocery store or wherever, or if they are just concerned about people coming into the home, we work with them and help them understand how to remain safe. In terms of our offices, we've remained open the entire time because we're an essential service, and all of the people who enter our office are asked the key questions and are temperature checked. And so we're very, very careful in providing a proper, safe environment for all of our staff and for all of the people that we take care of.
Jan, you've been in the healthcare delivery system for a long time.
I have, indeed. I'm not going to say exactly how many years, because that'll be keeps going, but I've been doing hospice in particular for 33 years. So.
And have you seen more acceptance? Have you seen people being more receptive to planning for the end of life?
It is still, I'm hopeful that it's a little bit more receptive, but it is still a subject that people just don't want to talk about. It's really unfortunate because we really should be talking about it. It's a gift to our families to be able to tell them what we think we would like, and you can always change your mind. You know, you don't have to say, well, this is what I would like, and then all of a sudden you're stuck with something that you feel differently about. So you can always change your mind, but the conversations are so very important. And we still have people who are afraid of the word hospice, thinking it means they're going to die. Fact of the matter is, we're all going to die. And being in hospice doesn't make it happen sooner. It actually, there's research that says that people with the same illness, if they are receiving hospice care, tend to live on average 30 days longer than those without.
What that brings me to is, how do we communicate to the consumer that an election to move into hospice services is really a way to extend life?
Exactly. It's a difficult message. There's so much stigma that people think about. The word death is just so frightening to the consumer at large. But it is such, often we hear from the people that we care for, boy, we wish we had gotten with you sooner. You've made such a difference. It makes it, you help the quality of my life. You make the quality of my life better. And those are the messages that I think are really important for consumers to hear. Accepting hospice care, By the way, we also have hospice graduates, people who do so well with the focus of the full team that they get better, and we help them graduate from hospice. They're welcome to come back at the point in which they are again eligible, but it's a service that is so all-encompassing that it is truly helpful to people so that their quality of life is better.
Is there anything that a consumer could do or a place they could go to find information to answer their questions when they're trying to make a decision with a loved one?
Sure. We have a national organization. It's called the National Hospice and Palliative Care Organization, and they do have a website, nhpco.org. Also, anyone can visit our website, and that's theelizabethhospice.org. And information is available. Key questions are there in terms of what can I expect in receiving hospice? What do I need to do? What does it look like? So I think those are two resources that could be helpful. I also didn't mention that we have a service called palliative care. And palliative care is for people who are not yet eligible for hospice care, but they would like to access a service that helps them with symptom management. Maybe they're having some pain or they're having some distressing symptoms that impact their quality of life. They can access palliative care from us, for sure, at Elizabeth Hospice. And they can also learn about that at the National Hospice and Palliative Care website.
So when you have a situation where a family member has been diagnosed with a terminal illness, but the family doesn't want to admit that, how do you deal with that?
Yeah, it's very difficult, and it depends on how the person themselves who's living with the illness, how they are able to communicate what they want to the family. We work very hard. We can have one of our physicians speak with the family and talk about it and let them know we can help improve their loved one's quality of life. So it is a difficult situation because oftentimes families just, for good reason, they don't want to lose their loved one. But if we communicate to them that we can help their loved one feel better, sometimes that helps them get over the hump. Because that is the truth. We can help their loved one feel better. And in the process, help them feel better as well about what they're doing in caring for their loved one.
Well, you said something earlier, and I laughed when you said it, but the fact that we are all going to die, which is a true fact. So it's how in the world, in this society, do we start talking about the eventuality that we all have and how to do it better?
Yeah. Well, I think there certainly are lots of opportunities, and there are lots of books being written about this that are helpful. Atul Gawande was famous for a surgeon, famous for his book in how to talk about it and how to die better. And Ira Byock has some publications as well. I do think just the COVID situation may actually help us in having more conversation, because people of all ages are dying with COVID and probably have not talked about their wishes with their families. And I always say, it doesn't matter what your age is, you need to be communicating what you would want. I also think we have documents that help us with the discussions, like the 5 wishes, and most states now have what is called a post or POLST form that gives people instruction on how to talk about end of life with their families. The other thing is we need to help support physicians who are so pressed for time when they're providing care, but it's really important for them to at least broach the subject with their clients.
Well, you said you've now been in the hospice field for 33 years. What was it 33 years ago that drew you to hospice that has kept you there all these years?
Oh my gosh, it is my passion. And it is about the full kind of care that we deliver. We do it according to what the person who's living with the illness wants us to do. It is not directed by a single member of the team or a physician only. It is directed by the person living with the illness, and the team kind of comes in and helps make that happen for the person. I just can't think of anything better to do with my life than help people exit this world, go on to the next life in a way that is meaningful to them, where they recognize how valuable they are as a human being, and how we can help them understand how they are loved, that they can die with dignity, and that they know that their life was meaningful. That, to me, you can tell I'm passionate about it.
Yes.
That, to me, is the most important life's work that I could possibly do. And I've been a nurse for longer than 33 years. Again, I'm not going to say how long.
You started young.
Yeah, so it's from my nursing background that I've come to this work, and it just is such a passion for me.
Is there something, Jan, that I have not asked you about hospice or about the services that the Elizabeth Hospice provides that you would like to talk about?
Well, I think you've been pretty thorough in your questions, and very much appreciate your asking and your covering this topic, because it is just critical to all of us. This is kind of a service that every single one of us can adopt at some point in our lives. So I just thank you for the opportunity to talk about it.
Oh, you are so welcome. I have only one other thing I want to ask you about, and that's your Rotary Club membership, because I was a Rotarian for many years and found it so beneficial.
Yes, I love it.
Do you bring information about hospice to your Rotary Club with programs or?
Yes, absolutely. We've had a couple of opportunities to talk about hospice and to talk about grief support. What we find is often people who are not experiencing a serious illness or a family member with a serious illness, in order to get them started talking about hospice, if we get them talking about grief support first, that seems to be an opening that is easier for folks to talk about.
Well, good. So a way in. That's a nice tip on how to get that conversation started. Well, Jan, I just can't thank you enough for your time today, and I'm so happy to have professionals like you in the healthcare at home field, because
thank you.
It makes it a wonderful place for all of us. So.
Well, thank you so much, Marilee, and thank you for doing this. This is wonderful that you are providing this service to consumers and letting people know what's available out there. So many people don't know. So thank you.
You are so welcome, and you stay safe there in San Diego, and you have a nice day.
You too.
Thank you so much for listening today. And a special thanks to our sponsors and partners, the National Association for Home Care and Hospice, Access, and CoreCute. If you've not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcasts. We're now on Spotify and most other places where you find podcasts. Like and follow us on social media. And join us, won't you, to spread the word and help choose home when care is needed.